Hello, everyone, and welcome back to Pharma Talks. And today we will be having a very special conversation because we will have a very special guest in our virtual studio. We'll be taking the entire year, I would say, experience what we have had from the events, from communications, and we'll try to sum up what we feel about how pharma and life sciences are to proceed in the next year. So today, please meet in our studio Paul Sims, who is well-known CEO of Impatient Health and very well-known, owner and the host of famous Pharmageddon. And, we all know him for Pharma as well. So, Paul, hello and welcome. And tell us a little bit what you want to talk about today. So, what you want to give us to the next year, what we can take with us.
Well, thank you so much, Natalia. It's always a pleasure. We've had the joy of doing a few interviews together this year, which has been actually a nice highlight. And you've done some great content in your company, and I'm sure you're doing well. In terms of where I want to focus, you said we should summarize the year, and I think it's very easy to summarize the year actually because headlines like AI have been very dominant. We've obviously seen a lot of turmoil and change in companies, and of course that means that there's a nice mix of both fear and opportunity for everybody. I think that very few people really know what the future's going to look like, though. Like, what is the vision? What is the destination that we actually want to get to?
The destination, vision, vector is very important. And, we know you, and we understand that today we can think like what we are fearing or what we need to take with us under this New Year Eve so that we need to remember and, and take to the next year.
Well, I think probably the biggest thing is that we shouldn't fear the change. Any technological change in history has always been a net job creator, not killer. And that feels difficult to say when so many people have lost their jobs recently. And it feels difficult to say when so many people are still saying, oh, we can just replace our comms team, our MLR team, our whatever team with AI agents. And of course, that efficiency is a big driver for us. But I don't think we have to fear it as long as we're open-minded and willing to recognize that there are many things which the AI will not do. It's much more than just human in the loop. It's what is the creativity, the strategy, the foresight, the decision-making, and the leadership. All of these things are not going to be done by AI in the short term. So as long as we recognize our place, our importance, then we have nothing to fear. So I would really like to remove the fear for 2026, and everyone listening should recognize that they have just as much opportunity, if not even more than before, to really make and to shape the future.
It's great to know, right? So, and we all like following your interviews, your posts and your events. And personally, I have seen more than once that you have been saying that pharma is not against the change. It's just have a courage of mouth to change. So it's just lack of this courage. So I really would like to ask you here, Paul, what must break for pharma to evolve? So what scares the industry so much?
I think that we need to stop asking customers what they want. And I realize that might sound really strange. We talk about customer centricity. We talk about customer experience. We talk about understanding, knowing our customer. The issue is, and if you study this, I've been studying this recently, Natalia, most customers don't know what they want beyond the short term. And even when they do, they find it difficult to articulate. There are many psychological conditions that get in the way from what they say and the truth of what they actually do. And there are at least 10 barriers from what they're saying and what they're doing between the two things. And it can be very dangerous to only listen and only follow. Firstly, if you do this, you will work in the very short term, like I said. Secondly, it's not differentiated. So everybody will end up doing almost the same thing because they all have access to the same customers. And so we will end up, right time, right place, maybe, but also being memorable and unique and desirable and good positioning. These are all still things that we have to care about. So when I say we need to stop following and listening to our customer, of course, I'm being slightly deliberately provocative. We do listen to our customer, but not until we have shown the customer it's catching whatever disease we've got today. Must be the end of the year. We must inspire our customer. So we have in our companies, we have brains, we have resources, we have time, we have wonderful meetings where we get together and we can brainstorm and think of what's possible. And we can be kind of inventors of ideas that could be really helpful for doctors. And I think it's us marketers, leaders, who must not be lazy and must come up with some great ideas. And then when we show it to our customers, then we listen. Then we hear the reaction, we hear the response, and we adjust then. So it's a very different situation, because if you start by listening, of course, it sounds like the right thing to do, but it will create only sustaining development. If you put a suggestion, ideally something which they've never seen before, out to the world first, then you will potentially create something that is disrupting and will get you a higher quality of relationship with your customer, because you will be seen as a pioneer, as somebody who is driving the agenda, who is differentiated, and who is thinking about the future, the authentic future of what our patients need at the end of the day. So it's a very different mindset just by changing the order. So you're still listening to your customers, but you're provoking them first.
This is a very interesting idea, because like us, like vendors, so when we are receiving the RFP, it's like kind of written in stone what customer needs, right? So this is very hardly difficult to think out of the box when everything is written over there. But I am with you on that one, because this is very important, because even two people in the very same room with the client, they can hear the client differently. So listen, but hear things differently. And sometimes it is not only like stopping to ask them what they want, because this is very secure area. You just ask what the customer, it's a secure territory. You can step there every time. When you are non-confident there, you don't know. But then there is the other area where we are not stopping very often, where we trust ourselves and trust what we hear from the client while listening to them. So, and we are proposing, right? So we are proposing and we are opening up with all these ideas. That's very true. That's very true. We are absolutely lacking behind in that.
I love how you said trust ourselves. That's another way of saying the same thing. It might look very different from don't listen to your customers, but trusting yourself. Something that, we beat ourselves with sticks in pharma, don't we? We always say we're not good at marketing. We are behind as an industry. We're old-fashioned. We're traditional. We're not like these cool consumer companies. And we like constantly saying we're not good enough, we're not good enough, we're not good enough. I think we need a little bit of belief, like you said, Nataliya, that actually we have a brain, we have all of the skills, just because we operate in a high compliance sector doesn't mean that we can't do good storytelling, good emotional resonance, good behavioral science. All of these things I know, Nataliya, you care about as well. And it's amazing how much we are blind actually to what is possible, just because we are so used to doing things in a certain way that we think that is the only way to do them. I think there is so much opportunity. We work in healthcare, which is actually the most emotional industry of all. I would say it's number one. I mean, Steve Jobs had to get people excited about laptops.
Yeah.
Laptops
Yeah,
are
that
not
was a tough.
very exciting. And you think of Apple as so cool or whatever, or maybe not cool, depend, your point of view, of course. But pharma should be the one thinking, my God, I have the opportunity here to do something really memorable. And just because we have to be compliant does not mean we have no opportunity. There's so much imagination that we could be using here. And
Exactly.
when I say this to pharma people, they say things like, this reminds me of why I started to do marketing in the first place. And they say things like this. It's like their childhood dream they've remembered again. And I don't think we have to lose it. So yeah, exactly like you say, trust yourself.
And especially this time when we are fighting for people attention, right? So
Mhm.
when we need, right, to get this attention, and then you will get this sport where you will be heard and you will be performing up to your abilities. So that's where exactly we need to believe in ourselves and trust ourselves to perform at our best.
Mm.
Wow, there's another section and another challenge I want to give you today.
Okay.
I want to talk with you about your 5 predictions for 2026. I know you are a very visionary person and you are making predictions all the time.
Mhm.
And, like most of them are happening actually.
Well,
So,
you know what, Natalia, I don't try to be right with my predictions because, firstly, no one knows the future, even me.
no, no.
uh, but the reason to do predictions is not to try and be right. In fact, I think pharma tries to be right all the time, especially medical affairs. They're used to being at the front of the class, being right for everything. But we have to be experimental. And of course, the only point of running an experiment ever is to see what's right. You don't know when you start the experiment. And that's what science is. We call ourselves scientific companies, but I think we are only really scientific in drug discovery right now. We need to be more scientific elsewhere. And by that, I mean curious and not making assumptions. So predictions are a way of talking about the future. And if you're so worried about being right, then you'll probably never make a bold prediction, because the bolder you are, the more likely you are to be wrong. Of course, eventually I might be right with all my predictions, but they might not happen in 2026. Let's put
Yeah,
it that
this is the thing,
way.
because when we are all predicting something, we are just thinking it is around the corner, but then couple of years it usually takes to happen. But if you tomorrow will just write some type of 2026 manifesto with
Mhm.
5 predictions that
Okay.
excite you the most, what exactly you will be putting there? So, like, briefly, so because, as you say, they shouldn't be accurate. No one knows the future. But working here, you understand what specifically we need to expect will be booming or going down. So whatever you predict.
Okay. Well, I'll try and give you 5, like
Yeah, 5.
first. So number 1 is, I'm sure, Natalia, you have seen this statistic before. We hear that 77%, I think it's 77% of content is not used.
Even Viva told that on the Viva Summit. Yeah.
And I think that I hope that what we will see is that more does not mean better. I asked somebody earlier in the year, I asked them why is 77%? And they said, you know what, Paul, nobody ever lost their job by making more content, right? So, you
Nobody lost their job of making safe decisions or
yeah,
asking the customer what they want or making overproducing or overcomplicating.
exactly. So there's always this desire to do more and add more and kind of justify your existence through activity. And
Can
we all
say
know
so.
activity is a vanity metric. And I would like to get rid of the idea of more is better. I think that naturally, of course, technology will really help us with this, but I think it requires human discipline, because as we have the ability to produce more on demand content, because through technology, more personal content, the very nature of what content production is, and of course your company is a pioneer in this field, but the very nature of what content production is will change. This is funny because I just talked about how we need to be more human and more emotive in our marketing and our messaging and our storytelling and our communication. That is also true. We also have to recognize that our customer has AI too, and they will be using it to filter us. So we need to also produce the other kind of content, which is not emotive at all, because it's going to be read by a machine. And it's going to literally change the nature of what content is. Of course, people are already talking about the move from search engine optimization to generative engine optimization, and how it requires a different approach to content production and what you put online, and machine readable information and factual information and putting it in the blah, 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 blah. So already we have started to think and talk and act on this, but I think it's going to go one step further. Doctors will use us, they will filter us with their own tools. And unless we are authentic and we can get to the point and make sure we are concrete in our claims, then we will fail. What this also will require, something else, is the ability to quantify the currently unquantifiable. So one of the reasons why we measure the things that we measure is simply because they're the things that are easy to measure. They're not always the most important things to measure. So human relationships, quality of relationship, really hard to measure, but we all know it matters. Trust, really hard to measure, but we all know it matters. So we have to enhance the use of the technology and the use to be able to come up with whatever you want to call sentiment scores, connection metrics, whatever, to be able to determine what is important for the machine and to be able to deliver what is different for the human. So it's a lot. We've got a lot of work to do, Nataliya. We've got a lot of work to do in 2026. No one should be losing their job. They've got so much to do, like I said at the beginning.
Like you're absolutely right. We have already started to embed into the content metrics the emotion score. So that we are measuring like how emotional the message is and what type of emotion it produces in the recipient. So we already started to work on that. And there are many companies who are doing that for many years already, even without AI. So, but now, like you're absolutely right with this machine, so we will be able to produce relevant content and really like we will be filtered by the machine. Like that's a challenge. I can see a pure challenge for us, for all of us, to understand the principles, to be able to cooperate with different machines of our clients. So that's truly a challenge. But thank you for that one. This is, I would say,
Well, that's
challenging,
only the first one.
inspiring.
I still have
Yeah.
4 more, I guess, so I need to keep moving. The second one is compliance will not exist as a department. Compliance will, of course, still be vital, but I think a mixture of the machine being helpful and also if you were a sports person, Nataliya, I know you do your daily swimming and your
Yeah.
various sports.
Yeah. Yeah.
Imagine you were like I don't know, a football player or something like this. Imagine you were
Really?
said, I don't know the rules of how to play football. I don't
Okay.
think you would ever be able to say you're a good football player if you don't know the rules, right? And I don't think we can say we are good marketers if we don't know the rules of marketing either. In fact, I think that the way to be an innovator and to become more powerful in a marketing role or indeed any kind of customer facing role is to be an expert on the rules of the game,
On the rules.
because you will suddenly know what is compliant and what isn't. You will get the power of knowing what you can innovate in or what the innovation could look like. And you will be able to harness the technology and know when it's lying or not. And you will be able to act with more freedom and more empowerment as you create your materials. And ultimately, you'll become a better marketer. You will become better at the messaging. So I think it's a really lazy attitude to think that compliance should be a separate department. It should be always outsourced. Of course, we can't become experts in compliance, and compliance itself is a human game, not just a set of rules. We all know how differently it's interpreted sometimes. But we need to try to start at least not saying this is not in my brain, I'm going to give it to someone else's brain. I think this is a lazy attitude. So I would like to see, and I hope to see in 2026, at least the beginning of dismantling of compliance specific departments, not to say that we dismantle compliance. That's very different.
So the compliance is not a this specific department. It's not the separate service in the future. So we are knowing the rules, we are obliged to the rules, and we are the soccer players, so successful. So in the end of the day, this is an interesting idea. So that means that this statement, we know that compliance is actually the problem why we are not so successful in omnichannel or we are not so successful in personalization is tiring up, so we are not using it anymore. So we do not have actually the excuse that compliance is the reason of not being able to
Yeah.
be as successful as the others, right? So we need
I
to know.
already really think it's a bad excuse anyway. The reasons I said before, we work in healthcare. It's the most emotive industry. We have so many positives in our industry, and we always think about the negatives. Oh, we can't do these things. Well, think of all the things you can do, way more than if you're selling laptops or cars or bits of metal or whatever it is that you're selling in other industries. We're selling life.
Life,
We're
quality of life,
of
continuity,
yeah.
everything about life,
No,
right?
what an opportunity that is. Jeez, we're lucky. We are so lucky to be working in
So
this industry.
lucky.
So shall I keep
What
moving
else?
on? Yeah.
Anything else left on the five
Yeah,
rules?
I'm still on number 2. Number 3,
Yeah.
I know this conversation is going too long. I'll be quick. Number 3, so right now we think about launch. Launch is very important, always will be. We think of it a bit like launching a rocket. Like we prepare for years and years and years and years. Everything has to be perfect. And we work out every inch of everything that happens. And then suddenly the wind is blowing in a different direction when we launch. And suddenly the whole thing is wrong and it all goes badly. And all the things that we said were going to happen didn't happen. And, we can blame governments or weather or other things, very easy to blame outside. And I would love to see us move away from this rocket launch mentality and towards driving a car mentality. So when you drive a car, you know what your destination is, but you don't necessarily know how you're going to get there because you put your sat nav on or your GPS device and it tells you there is a traffic jam on the way that you thought you were going to go. And actually, you should go a different way. And technology has been a great enabler in making sure our journeys, we don't have to spend hours planning them anymore. We can just get in the car, press on, go. And we need to think that way about launches as well, because the technology is now there to give us real-time insights. And the question is whether we're brave enough to act upon the insights, whether we're confident enough to act on the insights. But the truth is that we should be able to start and adapt according to market feedback. This is agility. This is evolution. Evolution is blind mutations, random, and then adapting natural selection. So this is how we evolved as a species, and it's how we need to evolve as launch and marketing champions generally.
It's a beautiful, beautiful idea. And being in the car instead of the rocket is such calming. As it on autopilot, it's still.
I'm not saying even self-driving cars. I'm just saying normal driving cars right now.
Okay, that is a great one. Like biotech and like any new launches today. So I think like they do have all of that, starting a rocket experience, which mustn't be so because like this is over complicated. So must be really the experience of driving car. So to the destination with the goal, with the help of technology,
Yeah.
smooth. It's absolutely with you on that one.
And you can still choose to ignore what your sat nav, your GPS computer is telling you. Of course, we do
Not
this
always a good
twice and we realize actually the computer.
advice.
Yeah, exactly. But so the human still has power and should always have power. And I guess that kind of leads me to my fourth one, because the fourth one is we have been AI obsessed, of course, for some time. I think we need to now become human obsessed. Where is the human most useful? It feels like everyone is trying to define what AI will do for them. We'll start with the operational effectiveness. We'll move to kind of enhanced visibility, as I always say, like being able to see what we cannot see, and we'll start to move towards more content production, creativity, all of these things. But how much time are we also spending defining what the new human role looks like? And I think that if we don't do just as much work on that as we do on the technology, then we are ignoring our human resource and our greatest power of differentiation. Like I said before, it's a choice. We decide. It's what a strategy is. It's we decide to be X and we're not going to be Y. And that is a human decision. It shouldn't be left to the machine. And the machine can't see everything. That's what great leadership is. So we need to focus on what the humans are going to do and empower
I
them.
haven't met that. Haven't met that for the weeks, months recently. You're absolutely right. Everyone is looking what the next move with AI. I haven't heard that.
And it's crazy, right? I think it will become obvious in 2026 that we forgot about this, and it will become obvious because everybody in our organizations will start to shout more and more. What is my role? Where do I go? What do I invest in my own capabilities and talents? What do I not invest in? And it becomes much clearer what application the AI will focus on, which then means what application will the human focus on. But I would like us to see a bit more proactivity here. I'd like us to, not wait until people are crying and feeling powerless before we tackle this question.
Does it mean all the people who were fired this year will be invited back after the people will reconsider?
Nataliya, I don't know exactly how you describe V7 today, whether you call yourself a technology or a software or an agency but a lot of people predicting that agencies, consultancies, they will suffer at them because technology will take over. I actually think that by 2030, all of these companies will be doing very well because they will have worked out where the human needs to be. They will realize that the technology is good for some things, but not for everything. And I think that we will have got over the hype kind of period and onto the more pragmatic period of making it stick and work as a symbiosis, as a togetherness that is equal, and we don't let the technology overlords rule us, and we still allow ourselves to make some decisions and not just be, leaving it to the robots.
Exactly. So it means like it's a journey. We still need to go through this fatigue stage. We will be
Of course.
tired that, and then like we will be
Already we hear the
realizing.
stories of the companies that fired the department and replaced it with AI. They're now trying to rehire the department because they realized
Yeah,
they went
yeah.
too strong.
Unfortunately, it is not happening overnight. It is just the
No,
process. So, and this is like could take us a little bit
it may
longer.
not happen in 2026, of course, but
Yeah, not necessarily. Like the ideas, the thoughts, the thinking must happen. So
uh,
then by 2030, we will get all the people back.
and Nataliya, your company will be thriving. I have no doubt about it.
Yeah, and this prediction, what I expected from you, no less, and this is what I believe. Because I
Good.
told in the beginning, nearly everything prediction will happen, and this prediction I love to be happening.
Excellent. I'm very glad.
Yeah. And
Look forward to
yes,
celebrating
as
your success. I look forward to celebrating this.
and I'm looking to your success. And the fifth one, so I think like the fifth
Oh yeah,
one left.
yeah. You're not going to let me go. Okay, so the fifth
No,
one.
I am not, absolutely not.
This is why another reason why you be successful. You don't let me slack. I think that it will start to become a bad thing to say that we are patient-centric, and the reason I say it that way is a little bit for the same reason as my first one, where I talked about how we shouldn't just listen to our customers, and that. So again, I'm being slightly controversial here. Patient centricity sounds like the right thing to do, to follow what the patient says and wants and does. The truth is that we as companies, we actually have to be science centric. There can only be one thing at the center of the circle. So you have to choose. Are you patient centric or are you science centric? And I think we still have to be science centric companies. And I think we have to inspire patients with what can be done. And I think we have to show people what's possible and then listen. But it's not the same as being patient centric. It's about being patient. I don't know what the new phrase could be, patient sensitive in some way. But I think that the day of treating patients a little bit like zoo animals and just looking at what they do and then trying to just follow them and just listen to everything they say and do whatever they say, I think that is actually dangerous for patients. Patients don't always know what's best for themselves. That's why we need doctors. And I think that they need us. They need us, and doctors need us, and they need us as experts to guide them, to show the light, to get people excited about looking after themselves, of getting them excited about health. Nobody's getting anyone excited about health. It's crazy. And it's a very motivational thing when you do it, when you start caring about your body. I myself was diagnosed as diabetic during lockdown, and I didn't really have any symptoms. So I was very lucky. And I actually see it as a positive thing because suddenly I started to pay attention to my health for the first time. I started to think, right, am I doing any exercise? Am I eating well? Am I getting any sleep? The answer to that is still no, unfortunately. But at least some of the things I've
You have
improved.
the other reasons.
Yeah. So, and I feel much better because of that, right? And I think when we all stop eating junk food every day, we feel better about it. So I think it starts with a recognition that being patient-centric in the purest sense can actually be damaging in the short term, at least.
I think this is the understanding of this patient centricity, and like if we really like follow what patient says and what patient like does, so that's really could be harmful. However, staying close, being empathetic, knowledgeable partner for the patient, this is what the industry needs, because then if you are close and we are caring about, like we are all patients are caring about ourselves, then we are also have a good partner, so who has the information, who can provide the advice and everything. So this is very helpful, and I do agree with you. So like this caring about the body, the health, so it's very exciting things, it's very motivating, and health is a treasure, so life is treasure, so this is the biggest value we might have, so like in entire life. So this is the value we need to bring from the day one to the last. So that's true. That's true. Great. Wow. Like time is flying, and I have the last section, which actually you teached me to do short answers.
It's all my fault. Now I'm
Yeah.
in.
Yeah. So this section is really great, and we want also to put some short answers from your side for
Mhm.
very, I believe, very contradictory, controversial questions. So
Okay.
let us get to that first round. Are you ready?
No, but let's go anyway.
Okay, let's go anyways. That's the answer I like. Well, the first one: AI replacing half of MLR processes.
I think it will happen. It has to happen. It's so far been very, very difficult. But I think that now there are some pioneering companies that are getting there to at least do half of it is achievable. And that will itself make a big difference. Otherwise, we'll
Correct.
never be conversational with HCP.
The platforms like LinkedIn will outperform Congress and booths.
Depends on your definition of outperform. See, the thing is that information is just one aspect of a congress or a booth. And yes, LinkedIn will definitely, and the web in general, will outperform information provision, but it will not outperform connection and all of the other things I said about inspiration. I think that there will still be value, and we see it today. The interest in face to face is increasing, not decreasing.
Interesting. Printed material will die.
Wow. Vinyl records have not died, even though they are an inferior form of listening to music. So I don't think the printed form, people like the smell of books. And the more we go to the digital, there will be a nostalgic desire to retain what we knew and loved, even with new generations. The new generation watches Friends. You know, they never saw it the first time round. They've watched it recently.
Yeah.
So there is a nostalgia that is strong and a backlash that is always going to be present.
We can feel that we are back to printed materials also in our way.
I think an expertise around printed material is not a crazy thing to have a capability, because it's a differentiator.
Yeah, it's a differentiator, right? Sales reps will be acting more like orchestrators than just pure messengers.
Well, I would say that's already should be true. I once did a survey, it was 10 years ago now, and I said, will the main skill of a sales rep still be selling in 5 years? And 90% of the room I was in said no. So I think that already we knew that at least sales reps should not focus on selling anymore. They should really be those, I don't know if orchestrators is the right word. Of course, that's the buzzword we like to use, but they should certainly be chaperones, concierges, inspirations, like I've already said many times. They should be partners. They should be partners in seeing the HCP as a peer as opposed to a superior, and working out what the best thing to do together is.
That's absolutely, and like the first channel, or like I say, people who personalize in action the message is like the sales rep who's always like looking into eye and saying things in the way that they will be heard. And this is not exactly in the way they are presented on the iPad, right? So this is the personalization in action, which is really very instinctive even.
I know you want short answers, but there's a trend right now from Natalia for machine companionship.
Oh my goodness.
So, in some instances, it might make sense, like old people who are lonely and they've lost their family, to be able to have a kind of almost robotic friend is powerful. But for young people who never leave the house anymore, they don't understand how to have a human relationship anymore, the replacement of friends with AI bots, I think, is a slightly dangerous thing. And there are some amazing statistics, like 80% of people under the age of 25 have never asked a partner to go on a date with them, right? And things like this. We've lost this ability to do things that were once quite normal, almost, and very human-like. And I think that we have to recognize that there is virtue in a human-to-human relationship.
It is definitely for us being like young people, like for me, it was very common thing
We're
I
both in
need
our
to be
20s
asked
still,
at
right,
least
Natalia?
twice for one evening and to decide where I go, right?
Yeah.
It's like with the new trend.
To be able to reject and be
Yeah,
rejected is
yeah.
very
I
important.
have to think whom I reject and where I go. So, and now like the problem is otherwise. So like people just were not even asked to go. So, and that's a problem.
Absolutely.
The next one, I would say, do you believe in TikTok as it for awareness and education?
Yes, because I think that even if nothing changes, the younger generation who see it as a completely viable and normal channel, far more normal than email, for example, they will become the mainstream customer and they will become the mainstream. So I don't even think that anything has to change for that to be true, apart from people just getting older.
But people getting older, they
Only
just
our own adult head that says that this is a children's channel that stops us from recognizing that it could be much more. And in general, even if it's not TikTok, short form video that is algorithmically determined is something that will arrive on other platforms anyway.
yeah. Last but not least, that actually, like we have already discussed, that patients will influence brand strategy directly.
They already are, unfortunately, sometimes for the negative. So misinformation is, for many people, more common than information. And the fact that pharma buries its head in the sand and pretends it doesn't exist and thinks it's not its job to address this. We're about to live in an era, as we already talked about, where the machine will eventually replace our search and our discovery. So right now, it's still actually mainly Google. And Google searches actually rose by 13% in 2025, despite the fact that everyone's talking about generative engine optimization and LLM search. But these AI bots will learn what's right from the digital world. And if pharma isn't counteracting the wrongness, then how can we say that we are an outcomes focused, patient focused industry when we choose to protect our own short term safety for the long term harm of patients? I think that that will no longer become a moral thing that we can live on. And it will become, of course, it's inevitable, it will happen, inevitable that people will talk about it lots more. Like, we know now that fake news is a problem. We didn't know that 10 years ago, but we do now, and we're sensitive to it. And this will also become a thing. So, of course, pharma won't get ahead of it. We will react as opposed to be proactive, but we need to be good at it eventually.
Absolutely. That's a part of the leadership we were talking in the beginning. And at this note, I want to thank you for this great conversation. It is always so much interesting to listen, to interact. And this were us real, not our avatars. So it makes this conversation, valuable. And I want to everyone who is listening to us to follow on LinkedIn, to stay connected, to ask your questions, stay curious. This was Pharma Talks with Paul Sims. Thank you very much and goodbye.
Thank you, everyone.